Hi, Dr. John Torres here, covering coronavirus, covering pandemic, covering news you might have heard, and giving you information behind those news, and hopefully information that can help you, your family, your loved ones, and your community get through this pandemic sooner rather than later and as healthy as possible. And then I also cover some other news that might not be pandemic related, but I think it's time to start covering other news as well. So the first one I want to talk about here are essentially the numbers, and where are we right now? Well, as you know, we're in this Omicron wave. We are coming down from this Omicron wave across the country, although there are some parts that are still having some outbreaks and still having some issues, particularly with hospitalizations, and we'll talk about that in a minute. But overall in this country, the rates have really plummeted. If you remember a few weeks ago, we were up around 800,000 cases a day, right about 800,000 cases a day. That's a huge increase from this time last year where we were looking at 280, almost 300,000 cases a day. We knew the Omicron variant would be more contagious, but luckily the Omicron variant also turned out to be not as virulent, as we call it, not as dangerous. So people caught it more, but they weren't having more issues because of it. They were having more minor symptoms. Although there were people who were hospitalized, there were people who were in the ICU, and unfortunately there have been people that have died from the Omicron wave we've had recently. That having been said, the numbers are starting to come down case-wise. And right now, last numbers, depending on what site you look at, the CDC says 291,000 cases, 7-day average, daily cases over 7-day average yesterday. Other sites, ourworlddata.com says 271,000, so it's coming down. But that's a huge drop from 800,000 just a few weeks ago. Now, what does that mean for us and what does that mean going forward? Well, that means a few things. Number one, there's a huge debate in the expert and the medical community and the epidemiology community, public health community about what to do, particularly with masks and mask mandates. And you're starting to see across the country a lot of those starting to come down. A lot of different states are saying, hey, we're going to go ahead and start dropping our mask mandates. New Jersey, for example, they said they're going to start dropping it about mid-March. Other states have already started to drop their mask mandates or are planning to do soon. But at the same time, what they're putting in place are mechanisms that those can go back up. Now, if you remember, about a year ago or so, we were talking about mask mandates and what different entities and different government organizations were doing with mask mandates. And what most of them had said, and most experts backed this up at the time, is look at your community. If there are certain rates of spread, if there are certain positivity rates with tests, if there are certain numbers you reach, if hospitals reach a certain number, then you want to think about putting mask mandates in place to try and get that more under control. And so those are the mechanisms they're looking at going forward. Well, hopefully, with this Omicron wave, we don't have another wave coming. However, there is a bit of concern. Right now, 99+% of the cases here are all because of the Omicron variant, but they're because of what we call the BA1 variant. There's another one called the BA2, which is essentially a subvariant. So they're both Omicron variants. They're just subvariants. In a way I best describe it, imagine you have a car and you have the LX edition versus the SE edition. Well, the LX edition is going to have more fancy things associated with it versus the SE, which is more basic. That's kind of like Omicron BA1 is more like the SE basic edition. The BA2 is more the luxury edition that has more complicated parts to it. And it looks like that is possibly a bit more contagious than the original Omicron variant, but it's not a variant in and of itself because there haven't been that many changes. It's what we call a subvariant. Now, the concern is that this subvariant, because right now, the last time CDC looked at this, that was 3.6% of the cases were because of this Omicron subvariant, the BA2. Just 3.6 across the country. But it's starting to creep up, and we're starting to see it more and more. Could it overtake BA1, the original Omicron variant? It could. And again, remember, it's more contagious. So this wave could start flattening out, maybe even go up a little bit before it starts completely coming down. Hopefully not. And hopefully people understand this and take the precautions they need, because first and foremost, the pandemic is not over. We're still in this pandemic. We're getting close to it being over, but it's still not over at this point. And a lot of people are looking at, okay, what do we do once we start getting to that point where it's over? How are we going to know it's over? What kind of things do we need to do? And I'll be addressing that over the next few weeks, both on this Facebook Live here and on my Doc to Doc series, which we do typically every Wednesday or Thursday, talking to different experts. This week, I'm talking to an expert about masking and when do we need masks? Should we start dropping mask mandates, particularly in school? What kind of masks work best? Those types of questions, and that'll be answered over the next couple of days. But when we look at the numbers here, again, looking at the numbers here in the U.S. and across the world, Again, this is a 7-day rolling average. If you look here, again, we talk about it being 271,000 cases here in the United States, Germany 167,000, Australia 28,000, and this is important because we'll talk about them in a minute. New Zealand only has 233, but remember, these are countries too that have less population than we do. So if you put them according to population, if you look at positive cases per million people, right now, the United States is down to 798 per million people. It was at a point where it was much, much higher than that. If you look at New Zealand, they're 45 per million people. If you look at Australia, they're a little over 1,000 per million people, but dropping precipitously. And they have dropped, their curve is following the United States curve essentially and dropping very, very quickly. Now, the reason I bring this up is because of what's happening worldwide and how the world's starting to open up, and particularly Australia. And it's kind of a tale of two countries, Australia and New Zealand. What's happening in Australia is they said starting February 21st, which is about a week and a half away, they are opening up to international travelers who are fully vaccinated. What they are allowing is fully vaccinated travelers who come into Australia, regardless of whether you're an Australian citizen or just a tourist. You can go ahead and go in there, prove your vaccination status, and you do not need to quarantine. However, if you have a medical exemption for vaccinations, so you're not vaccinated, but they still allow you to come in, then you're going to need to quarantine in a hotel before they let you in the country and just roam the country. For those that are unvaccinated, they're still not allowing them in yet. And I think we're going to see that in a variety of countries. The vaccinated are going to have more freedom to move around versus the unvaccinated because they want to make sure that they keep it under control, the virus. Now, compare that to New Zealand. New Zealand right now is having a bit of a surge in their Omicron cases. They are just starting to get their Omicron cases, and they're about a month behind Australia and the United States. And so we expect them to go up and then come back down over the next month or so. But in the meanwhile, they are restricting travel, and they have pushed back the border opening they were going to have for New Zealand citizens, particularly those from Australia. And so now what they're doing is they're going to open it up incrementally over the next few months. Initially, there's going to be New Zealand citizens from Australia, then New Zealand citizens from other parts of the world, again, fully vaccinated. And then they're going to open up to people who are fully vaccinated from visa-free countries, they think by July. And by visa-free countries, there's about 60 countries that New Zealand lets in without having a visa, the United States being one of them. And then by October, they're going to open it up to the world. Now, again, this is assuming that Omicron stays where it is and doesn't get much worse after this. And the surge they're having is going the way they expect it. But the thing about New Zealand, very high vaccination rate, and they want to keep it under control. They tried a zero COVID policy, which did not work, so now they're trying to just control the COVID. That's their new policy. Seem to be doing a pretty good job. However, we're keeping an eye on that. Hopefully they are able to open up when they can and when they're talking about it, and perhaps even sooner, depending on how Omicron goes. But I think the bottom line for all this is that realize the pandemic is not over, but we are starting to get to the point where, like we talked about a year ago, the light at the end of the tunnel, we're starting to see the opening to the tunnel, we're starting to see the end in sight, but at the same time we have to realize that that can be pulled back very quickly by having another variant that pops up. Best way to avoid a variant, getting vaccinated, getting your booster shots, that can help keep you safe, but those around you safe as well. And so that's where we are with the numbers right now. And again, they're dropping here in the United States. Hopefully they keep dropping. But also remember, hospitalizations lag by about 2 weeks and deaths lag by about another 2 weeks. And even though Omicron isn't as deadly as the Delta variant and the other variants, it still can cause hospitalizations and deaths. And those are high just because of the sheer numbers. Again, that 800,000 number we reached. So still expect to see a little bit on hospitalizations and deaths before they start coming down because they are certainly going to lag at this point. Now, again, those are the numbers. The other thing I want to talk about is there was an interesting study out, and it was about cardiac effects of COVID once somebody got COVID. And they did this study, and they looked at essentially hundreds of thousands of people, compared them to millions of people. And to give you the numbers, they had 153,760 people who had COVID. They compared those to over 5.6 million people who were contemporary controls, as they call them, and then 5.8 people who are historical controls, which did not have COVID. And these are people that, so totally they looked at over 10 million people for the study to try and find out what COVID would do, particularly to the heart, over a time period. And what they found was actually pretty interesting and unfortunately a bit daunting. They found that up to 12 months later, people who had COVID could start getting cardiac symptoms. And this is regardless of whether they were hospitalized, regardless of whether they had severe symptoms, they could start getting cardiac issues. And the cardiac issues they talked about, just so I can read this here, these included what we call cerebral vascular disorders, dysrhythmias like heart dysrhythmias, essentially palpitations, things like that. They also had inflammatory heart disease, which is a myocarditis type thing, ischemic heart disease, think heart attacks, heart failure, thrombolytic disease, which are the pulmonary embolisms or cardiac embolisms that can go to the brain, and other cardiac disorders, including hypertension, atrial fibrillation, which is part of that dysrhythmias they're talking about. And what they found out is, again, 12 months later, people were getting these type of cardiac symptoms. The reason we think this is happening is because it turns out that COVID, although we think of it mostly as a respiratory disease, it doesn't always stay in the lungs. It goes to other tissues. If it goes to the heart tissues or the blood, it can be a vascular type infection, and it can be a vascular disease, which can cause these vascular problems, and that's why the heart is being affected. So the bottom line here, what's the bottom line? Protect yourself from COVID. I know a lot of people say often that COVID is just a cold or it's just a flu. It's not. It's a virus that can cause severe complications. It can cause long COVID. And now, because of the study, we're seeing that long COVID possibly could cause these cardiac issues that unfortunately could stay with people for the rest of their life and could even potentially shorten their life period. So you want to be careful with that. Of course, vaccinations can help keep that under control because it's not going to let that viral load build up as much, and it's not going to affect not only your lungs but your cardiovascular system as well. So you want to be careful with that. Now, the last thing I want to talk about is a non-COVID study here that was done. It was very interesting. It was about sleep and weight loss. And what they found is that people who ended up having issues with sleep, in other words, they were only sleeping about 6.5 hours a night, if they were overweight and they increased that sleep, they ended up losing or ended up eating less calories and potentially losing weight. But so what they did is they ended up taking adults who had sleep patterns where they only slept about 6.5 hours a night. They also had a BMI between 25 and 29.9. Now that puts them in the overweight category. Below 25 is normal for the most part. Above 29.9, so 30 and above is obese. So they were in that overweight category that a lot of us are. And what they said is if they spent time around an hour talking to them about sleep and what we call sleep hygiene, then they ended up increasing their sleep around 1.2 hours more. When they increased their sleep about 1.2 hours more, they ended up eating 270 less calories a day. Might not seem like much, but that 270 less calories a day, if that's carried out over a year, that's a 26-pound weight loss in a year that you can get from not really doing anything other than just staying in bed and sleeping an extra 1.2, maybe a little bit longer hours. And they found out that by teaching them the sleep hygiene techniques, they were able to do that. And some of these techniques actually used smartphones or tablets. And so, often the advice is to put your smartphone down half an hour before you go to bed. They said there are judicious and practical ways to use that to help you sleep, and there are apps for that as well. But one of the important things to realize is that sleep is important, not just for our brain health and to keep us awake the next day. We know it's important for our heart health, but now it's also important for our overall weight. And this we think is happening for a couple reasons. One is we think that because we lack sleep, that we have more cortisol in our body, more stress, and that cortisol drives us to eat those foods that we normally wouldn't eat, high caloric foods. On top of that, it also doesn't allow that appetite suppression hormone to go through our body like it normally does to suppress our appetite. So instead, we have this ravenous appetite. And being an emergency room doctor, I can tell you, middle of the night, when you're sleep deprived and you're taking care of patients and you're under stress, you reach for those high sugar foods, those high fat foods, because you're stress eating. And that stress eating can add the weight. So if you get to sleep, you're not going to do that as often. And again, by adding these simple techniques, by getting a little more sleep, they ended up basically not eating as many calories, 270 calories less, without even really trying, because the researchers did not restrict their diets, did not restrict their calorie intake. They did this on their own, and they think over a year that could lead up to 26 pounds of weight loss. So an amazing thing from just getting enough sleep. And now we know that sleep is important, not just for our overall health, but for our weight as well. So hopefully you can get more sleep and can figure that out. Again, talking about here, we've talked about a few things. Number one, the numbers happening here. Omicron, the cases are coming down, which is great, but we're still not out of the woods. We need to be careful. Number two, cardiac effects up to a year later after people recover from COVID is a real and serious problem and could be serious and lifelong problem. And then number three, we talked about sleep and how getting that extra sleep, even a little over an hour of extra sleep at night for those who are sleep deprived, around 6.5 hours or so at night, can really go a long way towards keeping that weight under control. So again, something to look forward to, something to try and get more sleep than you'd normally get, because most of us, face it, are sleep deprived. But thank you very much. I hope you have a fantastic week. And as always, I hope you stay as happy and as healthy as possible. Thank you.